Hi, today I'll be speaking about type 2 diabetes in Aboriginal and Torres Strait Islander children and adolescents living in remote areas of Australia. According to the World Health Organization's International Classification of Diseases, diabetes is a metabolic disorder that is characterized by high blood glucose in the context of insulin resistance and relative insulin deficiency. Type 2 diabetes is the most common cause of diabetes, and it occurs when the body becomes resistant to the normal effects of insulin and loses the capacity to produce insulin in the pancreas. Complications include serious damage to blood vessels and nerves, coronary heart disease, stroke, kidney failure, even limb amputations. According to the Australian Institute of Health and Welfare website, in 2019, the term rural and remote areas encompasses all areas outside Australian major cities. Using the Australian Standard Geographical Classification System, these areas are classified as inner regional, outer regional, remote, or very remote. I've chosen this disease because it's one of the fastest growing paediatric chronic diseases worldwide, and there is growing concerns regarding the emergence of type 2 diabetes in Aboriginal and Torres Strait Islander young people. Based on combined data from the National Diabetes Service Scheme and the Australasian Endocrine Group, between 2006 and 2011, the incidence rate of type 2 diabetes for Aboriginal and Torres Strait Islander young people was 3.5 times that of non-Indigenous young people. I've chosen remote Australia as the Australian Burden of Disease study in 2015 indicated diabetes was almost twice as prevalent among Aboriginal Torres Strait Islander people living in remote areas than non-remote areas. The highest prevalence rates of type 2 diabetes in Australian children and young people were found in the Aboriginal and Torres Strait Islander population. This comes from a study on type 2 diabetes in young Indigenous Australians in rural and remote areas published in 2012. In addition, according to the Australian Aboriginal and Torres Strait Islander Health Survey, between 2012 and 2013, the prevalence of diabetes in the Australian and Torres Strait Islander population ranged from 7% in major cities to 12% in remote areas. According to the Global Burden of Disease Study data in 2019, Australian children and adolescents aged between 5 and 14 with type 2 diabetes attributed to 0.28% of total burden of disease. The Australian Burden of Disease study, released in 2015, found that type 2 diabetes was the 12th largest contributor to Australia's disease burden, and this accounted for 2.2% of total disease burden. The same study found that diabetes accounted for 9% of the disease burden in the Aboriginal Torres Strait Islander population by the year 2015. Non-modifiable risk factors include family history, age, gender, and ethnicity. In 2012-2013, Aboriginal Torres Strait Islander Health Survey identified risk factors such as overweight and obesity, high blood pressure, abnormal cholesterol and triglycerides, smoking, and inadequate fruit and vegetable intake. For example, data from the 2012-2013 Australian Aboriginal and Torres Strait Islander Health Survey found that 46% of Aboriginal and Torres Strait Islander people aged 2 years and over had inadequate daily fruit intake, and 92% had inadequate daily vegetable intake. 38% of Aboriginal and Torres Strait Islander children and adolescents aged 2 to 17 were overweight or obese. Indigenous populations worldwide are disproportionately affected by diabetes and contributes to the health inequalities experienced by Indigenous peoples in developed countries. The disproportionate rates worldwide can be attributed to a variety of similar environmental and genetic factors, including intrauterine exposures, early life events, infant nutrition, obesity and overweight, and physical inactivity. Trends in type 2 diabetes among adolescents had been studied in Auckland, surveying of the Maori and Pacific Island ethnic group. It was found that between the years of 1997 and 1999, type 2 diabetes accounted for 12.5% of new cases, and a big jump between 2000 and 2001 to 35% of new cases being type 2 diabetes. Similarly, in Canada, the prevalence rate for diabetes are 17.2% among First Nations individuals compared to 5% of the general population. And this data came from a study published by the Canadian Diabetes Association in 2018. In addition, the US Department of Health and Human Services in 2006 indicated that the death rate for diabetes in American Indians or Alaskan Natives was 1.9 times higher than in non-Hispanic whites. Social and cultural factors can also contribute to the diabetes emergence in children and young people. This includes colonisation, which was a disruption to traditional diet, lifestyle and culture, leading to poor dietary intake and high levels of sedentary behaviour. In addition, low levels of education, poor housing, poor access to services, lack of access to nutrient-dense food, and loss of connection with land are all factors contributing to prevalence of type 2 diabetes. There's limited population-based incidence data reported from Aboriginal Torres Strait Islander children and adolescents. This is an issue as they are underrepresented in data due to lack of reporting and undiagnosed cases. In addition, it seems that routine data collection systems have underestimated true disease occurrence. This is due to lack of identification of Indigenous status. Thank you.